Columbus, Ohio, but I moved here a couple months ago, so I'm a new Iowan. First of all, I'd like to thank you for your support of women's healthcare. And healthcare is really important for American women who make healthcare decisions for themselves and their families. I recently read an article that more than half of women put off or completely skip regular checkups with their OB/GYN or primary care doctor because they cost too much. As part of healthcare reform, what are you going to do to ensure that women have better access to reproductive health care?
Well, this gets back to what we were talking about earlier about the role of primary care. For most women, contact with their OB/GYN is their primary care. And one of the things we have to do is make sure that we're providing incentives for people to have more frequent contact with primary care providers so that they diagnose problems earlier, they treat them earlier, and they get a better healthcare outcome, which saves all of us money. And so in the bill, there's enormous incentives. And one of the amendments that I introduced was the Access to Frontline Providers Healthcare Bill, which creates an opportunity for people who incur enormous debt going to medical school or getting their PA degree or nurse practitioner's degree, come out and have a huge debt, and when they look at their options, they look at Iowa and look at those numbers that I was showing you and realize that they're going to make a lot more money working in a state which gets much worse outcomes but pays better. And the best example I can give you, and I took this chart to every meeting, is that Medicare measures quality outcomes based on 17 different categories. Right now, Iowa ranks in the top 5 in the states all over the country in quality outcomes and in the bottom 5 in Medicare reimbursements. Louisiana ranks number 1 in cost per patient per Medicare patient and 50th in quality outcomes. That is a broken system. And so the reason I've been pushing so hard to change the way Medicare reimburses Iowa providers is because the more equity you build into that, the more primary care providers, OB/GYNs, are going to be available to women to take care of their basic health care needs. And there's a lot of programs in the bill that reinforce that, and providing care to women is a huge priority.